Ladies and gentlemen, once again, you are most welcome to the online pregnancy school. Call your friend, call someone you know, and let the person learn. Because if you have knowledge, you'll be able to respond to a situation that needs what we're going to talk about. I hope you have been learning and you have some of your questions answered. We still have some questions that have come to us about the family planning methods, and we're going to try and answer them as we go through today's session. And if you haven't done that yet, kindly go ahead and hit the subscribe button and remember to turn on the notification bell. Also, give us thumbs up. Follow us on Facebook. For those who have been following us on Facebook, we say a very big thank you. We receive all the comments and the encouragement. So let's start today's discussion. Once again, it is my pleasure to welcome Dr. Benedict Afari, an obstetrician gynecologist. I'm sure you have seen his face. He's shared a lot, and the enthusiasm with which he talks about his work is just amazing. If you are in Accra and you are around the Ga East area, just go to the hospital and you'll find him there. He will be very willing to see you and answer any questions that you have. It doesn't have to be a female. You could be a man. You have questions about reproduction or any of the topics that we have discussed, kindly go there and find it. And if you're around the world anywhere, send us a message. I will be very happy to come back and share the answers with you. Doc, you are most welcome.
Thank you very much. Thank you very much.
It is always a pleasure to have you, and I'm so grateful for all the time you have spent sharing your knowledge and experiences with us. Today, we're going to continue with our discussion on the family planning methods. And I'll leave it to you now to share with us what we want to talk about today. And as I said, we have some questions that we will answer as the discussion goes on. So, ladies and gentlemen, you are welcome to today's session. And today we're going to discuss the IUD. And doctor will tell us what it is and how it is used, as well as some of the issues that can come with that. So, Doc, you are most welcome. We can go into detail with the IUD.
So, today we are talking about the IUD, intrauterine device. There are basically two of them. The one that contains hormones and the one that does not contain hormone. So the one that doesn't contain hormone is popularly called copper T. Then you have the levonorgestrel. That's the one that contains hormone. So let's look at the copper T, the commonest one. So it's basically a small plastic rod in the form of a T that has a string attached to it. So if you look at the device very well, it has some copper metal that are wound around it. So it basically goes through this side. Yes. So what is going to happen is this is what eventually is going to be put in the womb as a family planning method. So I have a miniature womb over here. This is like a womb. So at the end of the day, when the IUD is placed inside, this is how it's going to look like. Yeah, so I have a miniature womb plus the IUD sitting inside. Then the string will be hanging through the cervix, but it will be in the vagina. It doesn't come out. Good. So basically, that is the IUD. So what does it do? Is to prevent pregnancy, and it does that by bringing out some chemical reactions that damage the sperm and the egg. So basically, once it's able to immobilize the sperm cannot get to where the egg is to fertilize it. Then it also creates a hostile environment for implantation. So there are times that maybe you may have fertilization happening. Probably the IUD is displaced, like it's shifted to one side. So let's say a stubborn sperm was able to bypass it and go and fertilize the egg. But when it comes to implantation, because it's creating some form of a hostile environment, implantation cannot occur. And IUD is very effective. So if you take about 100 women, it is said that about less than one pregnancy in 100 women, or if you take a percentage. So let's say the risk of getting pregnant is less than 1%. So it's very, very, very effective. If it's almost no pregnancy, that is if it is inserted well and it is placed well in the womb and there are no complications with it, it can prevent pregnancy. And this can happen up to about 10 years. Once the IUD is still in the womb, it can prevent you from getting pregnant up to 10 years. But anytime you want to get pregnant and you remove it, you can go ahead and get pregnant. So the IUD is one of the contraceptive method, very effective. The copper T that we are discussing now does not contain hormone. So for all those who have issues with hormones, they can effectively use copper T and they wouldn't have any issues with it.
Hi, Doc. Now, somebody will ask, going to put copper inside a woman's womb, is that not going to cause problems?
No, it is innate. Innate. That means it doesn't cause any reaction to the woman systemically and locally. So local reaction, no. Systemic reaction, no. So it is innate. It doesn't react with the woman's body. Yes.
I see. Because he said that to create a hostile environment. You see?
Yes, for the sperm and the egg, not the body of the woman. So it is the sperm and the egg that it is attacking, not the rest of the body. Yes.
Okay. Yeah. So who would you recommend this for? Is it a young woman or a woman who has had the number of children that she wants? Because he said 10 years. And yes. So that is long. So
even sometimes up to 12 years, but I mean maximum, but 10 years is the commonest time that we normally anticipate.
And it can be in there for 10 years.
Yes, please.
And nothing will happen, no infections, nothing.
Yes, so we'll come to that.
Okay.
And let me address the question of who can use it. Actually, any woman at all can use it, whether you've been pregnant before or not, you can use it.
Okay.
It doesn't depend on whether you've not been pregnant. You know, there are times that we feel that any woman who has never been pregnant shouldn't use a contraceptive method. And a lot of people don't like the idea that you've never been pregnant and you use family planning, especially the hormone-based ones. But IUD, there's no hormone.
Okay.
So whether you've been pregnant before or not, you can use it.
Okay.
Then even pregnant women, just after you have delivered, within 24 hours or even 48 hours, you can have it done. You can even be given, when we do CS for you, it can be placed in the womb just after CS, or it can still be placed in the womb just after you have delivered. So up to 48 hours. But after that, we recommend that after 1 month, because sometimes the woman may be bleeding, having low care and all that. So we prefer after 4 weeks. So if you are not able to insert it within 24 hours or 48 hours, then you can do it after a month.
Okay.
And most people at 6 weeks, they come and have it inserted. Then you can even insert it just after you have done an abortion. Yes. Yes.
I see.
Yeah, so yeah, you can. So anybody at all can use it. And these are even scenarios. A breastfeeding mother, you just delivered, you had CS, you've had an abortion, you don't want it to recur again because it was an unwanted or unintended pregnancy. After that, you can have an IUD inserted if there are no issues. But if, for example, maybe we are not sure there's an infection or we are not sure everything is out, then you will not be a candidate for the IUD at that time.
Okay.
Then let me even add that, for example, those who have full-blown HIV/AIDS, they are not on treatment, those people will not give it. And those who have an active infection going on, we
Okay.
wouldn't give you an IUD. So if you take all these people out, the rest of the population, everybody is good to go. Of course, maybe except yes. So those are the exclusion criteria. But if not, a whole lot of people can have IUD inserted for them. Yeah.
Okay, doc. So who can insert it? Is it the medical doctor? Is it a family planning provider, a nurse, a midwife? Who can insert it?
So the person who can insert is somebody who has been trained. So you can have a nurse trained to do it. You can have a midwife trained to do it. You can have a doctor trained to do it. So once you've been trained, you can do it because it's an invasive procedure and it's a very technical procedure to go through. You have to observe a lot of aseptic procedure, and you have to know your anatomy because you can't just go inserting IUD if you don't even know the anatomy. You should be able to do a pelvic examination before you insert it. You should know the depth or the length of the womb. You should know the position of the womb because there are some womb that are not well aligned or well positioned. So you cannot put an IUD inside. So anybody going to insert the IUD should be somebody who is trained. You understand anatomy, you understand the reproductive organ or system before you can do it. Other than that, you are not qualified to place an IUD in any woman. Yeah.
That is good to know. Distinguished ladies and gentlemen, if you have just joined us today, we are talking about the IUD, what it is, what it does, and how it is inserted. Doc, in the example, you use a miniature womb, but in real life, what is used to insert this into the womb?
Good. So the whole procedure, you have to explain the procedure to the woman for her to understand what it is about, the issues involved with it, and she has consented to have it done. So a woman is going to be positioned in a place that her dignity and privacy is assured.
Okay.
And we are using some instruments. The instrument we use, we have a couple of instruments. So we use something we call the speculum. The speculum is a device that helps us to expose the cervix and the vaginal wall. Then it will give us opportunity to put in the IUD. We also use a device, we call it a uterine sound, to be able to measure the length or the depth of the uterus. You don't want to put the IUD in the cervical canal or far off the endometrial cavity. So you need to know the length or the depth of the uterus. So we use the uterine sound. Then we also use a sponge holding forceps. That's what we use to clean. This you have to observe aseptic procedure because you are entering the womb. So you cannot afford to carry infection into the womb. So we use something like that. We use a device that will help us to hold the cervix, that's the mouth or the neck of the womb, in place so that the entering will not be difficult. Then, of course, we need to have cleaning agents. So we have Savlon, cotton wool. Sometimes we even use iodine just to make sure that we have cleaned the place and sterilized the place well to prevent infection from happening. Then, of course, the device itself, what I showed, and there is a way we do it. We call it a non-touch technique. It has to be put such a way that the device itself, you will not touch it because we want to prevent or reduce the risk of introducing infection. So it goes through a certain procedure before it is put finally inside the womb. Yeah.
That is very interesting. It's not like the ones we have seen before where you put it on the arm and it's easy. So, okay, so this one has to be done by a well-trained person. So if you are listening to us and you are deciding to go for the copper T or the IUD, please remember that it has to be done very well, technically, so that you don't have any infection. And doctor said that it can be in you for 10 years or 12, but most people it is 10. And even the time that it is done. So if somebody delivers and within 4 weeks or 6 weeks, this person wants to have this, you know, the person after delivery would have the loci, as you said, which is the blood and later on turning to some brownish thing coming and all that. So the inside of the womb is already in quote exposed. So this has to be done very well. So please make sure that whoever you go to is someone who is trained, who has the equipment or the resources to use to do this. Don't take it lightly at all because you don't want to have any infection. Doc, okay, so now we have seen how this is done. What are some of the things people should be aware of in terms of complications that can happen? We know that infection is one of them. But are there any other things? And some people are concerned about the thread
The
coming out.
string.
Mm-hmm.
Yes, yes. We'll address it. So, as part of some of the adverse effects, you could have some changes in the menses. So, usually, maybe some heavy bleeding within the first 3 months. You may have some heavy bleeding, but after a while, it resolves. Then, some people can complain of some cramps during menses. Yes, so there are some cramps that people can report during menses or the changes in the what do you call it, the menstrual flow. So it may be a bit increased, but after a while it resolves. So you don't have those kind of hormone-based symptoms like headache, dizziness. It doesn't come with IUD. IUD basically may be the bleeding issue or the cramps you may experience, but all this can be managed. Then the other thing is that we have some non-contraceptive benefits. I always want to talk about that so that people will know that it's not only about preventing pregnancy. So one non-contraceptive benefit is protection from endometrial cancer. Endometrial cancer is actually cancer involving the endometrial lining inside the womb. So research has shown that there's some protection for women if they are using IUD. So it is good. Then you know the convenience. You don't have to be coming back often to have anything removed or anything given you. If for 10 years you are not ready to get pregnant, it is there. So the convenience is there, and even the cost. If you insert something, even if one time it is expensive, for 10 years, that's a whole investment. So unlike some of the methods that you have to keep going back to it. But for 10 years, we pay like one-off payment for 10 years. That's a good investment. So
I see.
once you fit the criteria, you can easily have it inserted. Yes.
Okay, Doc, now when it's been inserted, is it painful?
Oh, no. Usually it's not painful. You may feel some discomfort, but it's not painful. You may feel some discomfort because we are putting a speculum there. We are holding the cervix, we grasp it a bit. So you may feel something there, but other than that, the insertion itself is not painful. Yeah, it's not
Okay.
yeah.
Can it come out on its
Yes,
own?
it can come out. Let me even say that, especially the IUD containing hormone, it can also be used to manage abnormal uterine bleeding or heavy bleeding. Sometimes we can put it in there and it will resolve people who have heavy menstrual bleeding or abnormal uterine bleeding. So it's also one of the uses. Then let
Okay.
me talk about some of the issues that you can have with the IUD.
Mm-hmm.
There have been some reported cases that it can fall off,
Mm.
especially if it is not inserted. Well, that's why you need a trained person to insert it. So, for example, if you are not able to put the IUD in the womb, let's say in the endometrial cavity, and it is around, let's say, the cervical canal, it can easily come out.
Okay.
And sometimes you can have displacement. It can be shifted to just one side, and it's not well placed in the womb. So
Mm.
you can have some displacement. Then you can even have expulsion, but not into the womb, not into the abdomen, not into the abdomen. Yeah, sometimes the string can come off.
Hmm.
Yes, the string can come off. There are some people that the string comes off. But even if the string comes off, the IUD device, the T-shaped one with the copper, is still in the womb. So you are still protected. Then there are some people that they may be perforation, but the perforation is probably not the IUD causing it. But maybe if somebody who is not trained in doing it, you can perforate the womb with your instrument, not the IUD. You know, this
During the
IUD is so
sounding,
flexible.
during the
Exactly. If
time
you
of the
don't have
sounding.
good, if you don't have a uterine sound and you are trying to poke it, you may, and especially for if somebody has delivered within 24 hours, 48 hours, the uterus is quite weak and friable.
Yeah.
So, or somebody who has had an abortion or a septic abortion, or somebody who has had problems with the womb in the past. Such
Mm-hmm.
people, if it's not done by a trained person, perforation could occur, but not with the kit, but probably what's the instrument that you are using that can cause the perforation. So we should be mindful of that. Yes.
Yeah,
But
thank you very much. This is very
all these
important. It means
problems,
that they should go to the right person, right, for
yes,
this to be
yes.
done. Okay. Please go
Yeah, so
ahead.
all these problems can be resolved once it is done by a right the person who has been trained. That just as you
Okay.
said, then we don't have those issues. I haven't actually in a very long time heard of maybe perforation or something, but sometimes displacement or it's falling off, but it is not even common. These are
Okay.
very rare. Yeah.
Hmm. So people should not be worried about it, right?
Yes, they shouldn't at all.
Okay, for some others, well, maybe this is answered by the fact that you said that the string doesn't come into the vagina. It stays, it's not in the vagina, right?
It is in the vagina. It doesn't come out of the vagina.
Out of
That's what
the,
it means.
okay.
Yes. So you wouldn't have the string just sticking out. It is in the vagina. Yes.
But
And let me even.
look, for that one, don't
Yes.
when the husbands complain that they are afraid.
Aha. Good. So the string is such that it doesn't even disturb the man. A man could even have sex with a woman with IUD, but he doesn't feel there's anything there.
Hmm.
Yes, the string is such that it doesn't cause any irritation, it doesn't cause any discomfort. I mean, a lot of couples, women who have IUD place, they have satisfying sex life and they don't complain of the string. Yes, they don't
Okay.
complain about it at all. Yeah.
Then for the
So the
men,
men shouldn't be afraid.
aha, because some of them might be afraid that
No, no, no,
if
no,
there's a string somewhere there, then that will be a challenge for them. And they might be afraid of getting abrasions and sores and all that on it. So, okay, so the men should not be afraid. Hmm.
no. Yes.
Ladies and gentlemen, we are talking about the IUD, and doctor has given us a lot of information about that, what it is, how it is inserted, and what it can do and what it cannot do. So, doc, are there any other things that you would want us to know about the IUD?
Yes, so I think most people are quite concerned about the cervical cancer angle. So let me just pass it through. You know, so I've already mentioned that it is even protective against endometrial cancer. So that is a good aspect. Then the thing about cervical cancer is that IUD does not cause cervical cancer. It does not cause cervical cancer. You know, cervical cancer is caused by infection with human papilloma virus. The IUD is not an organism. It is not HPV. So technically, it cannot cause cervical cancer. So everybody should be assured that IUD does not cause cervical cancer. And the copper also, it does not cause any reaction. All that it does is to immobilize the sperm, create a hostile environment so that the sperm and the egg that they don't meet to cause pregnancy. But apart from that, it will not affect the woman in any way. It will not cause any reaction in the womb. It will not cause reaction at the cervix. It will not cause a reaction in the vagina. It will not cause a reaction anywhere in the body. It is innate. Innate means that it does not react with anything in the body. Then there's another issue about infection with IUD. You know, IUD does not protect women from sexually transmitted infection. So an IUD too does not like infection. So that is why, yes, it doesn't like infection. So that is why you have to be careful, because if you think that, oh, now that you are not getting pregnant, you could, have maybe unprotected sex, or you not be faithful and all that, you could get an infection. And most of the time, if you have an infection and it's that bad, we may have to remove the IUD. Not because it's the IUD that is causing an infection, but because it is delicate and it doesn't like infection. So if you keep having recurrent infection, recurrent sexually transmitted infection, IUD probably is not a good method for you.
Okay.
So IUD it respects itself. It is very
it is a lady.
yes, it's a lady, so it doesn't want you to introduce anything there. So just take good care of it, and it will also take good care of you. Yes.
Okay. But doc, is
Yeah.
it expensive?
Or it is not expensive. Most of the family planning commodities are subsidized. So it wouldn't cost, depending on where you get it, I don't think it will even cost more than 100 cedis. Some places, especially in government settings, it couldn't really cost much. Maybe some 20 cedis, 30 cedis, 50 cedis.
That's just a few cents, right? A
A
few
few
cents.
cents. Yes, yes, yes.
Okay.
So it doesn't cost much. Like I said, it's an investment for like 10 years if you're not ready to get pregnant. Yes.
I
Yeah.
think people should consider that as an investment because you have been saying
Yes,
that it is an
exactly.
investment. And if
Yeah.
you consider,
Yes.
and in fact, even for those who don't want to have children yet,
Yes. Yes.
it is better to prevent yourself from becoming pregnant than going in, getting pregnant with all the complications, the mental health issues, and people going in for abortions. Some people have died, from that. People have had severe infections from that. So it is in everybody's interest. Please, if you are not ready to get pregnant, don't get pregnant. I think that would be it. Doc, your parting words.
Yeah. So the IUD is one of the very effective contraceptive method. It is actually, the other name is a long-acting reversible contraceptive. So you can change it at any time that you want, but it can be there for a very long time, 10 to even 12 years. It has a lot of benefits.
Okay.
Once it is done by a qualified, trained health personnel, you achieve all the benefits there is. And the misconceptions about cancer, infections, and all that, we've discussed them. Once you take care of yourself and the precautions we talked about, you are good to go. So I'm encouraging a lot of the women, those who desire contraception. IUD is one of the very safe, non-hormonal, effective contraceptive method for them. So they should come and get the method. They will get all the benefits there is. Yeah.
Okay. Somebody would also say that if you do that, if we promote it like that, then if you are not careful, people become promiscuous, because they know that for 10 years, if I have this inside of me, I'm not going to become pregnant, so I can sleep around. But I think that you have made caution with how people can become infected with HIV, other sexually transmitted diseases. So that is not something for you to just go about sleeping with.
Yes. Yes. You have spoken my mind.
Thank you. Thank you so
Yeah.
much. Thank you.